We've talked about the actual Whipple operation and the technical parts of it, but I'd like to talk now about the hospital stay and what you can expect for the first few months after recovering from a Whipple procedure. Immediately after surgery, patients will go either to a step-down unit or an intensive care unit, depending on how your medical condition is. If you're healthy without any major significant medical problems, then more likely to go to a step-down unit. If you have a lot of medical problems that need to be managed, then you may spend a day in the intensive care unit. After a day or two, though, you'll be on a regular floor ward. The first day you'll have a tube in your nose called a nasogastric tube. We generally will get the breathing tube out right after surgery, so the patients will wake up without any breathing tube in. You'll have a little oxygen on, and then there's a tube in the nose called the nasogastric tube. That would be a tube that would go through the esophagus and would be in the stomach that will get any stomach juices out. But after about the first day or second day, we'll go ahead and remove that tube. And we'd like you to get out of bed the next day after surgery. The first day in the afternoon, dangle with the feet on the edge of the bed, but we'd like you sitting up in a chair the next day after surgery. And by the first afternoon of surgery, as long as your medical condition allows it, we'd like you walking out into the hallway. We really want to get you up and around and ambulating, that is walking in the hallways, because that will help prevent pneumonia, that'll help prevent blood clots and infections as well. You'll have a little spirometer to help with your breathing, and you'll be getting an anticoagulant called heparin or Lovenox to help prevent blood clots. But early mobilization and getting up and around after surgery is very critical for your recovery and to avoid complications. The hospital stay, as I mentioned, is about an average of about 7 to 9 days. And obviously if there's a complication, which can occur in about 30 to 40% of patients. So again, the Whipple procedure is a fairly complicated surgery and complications do occur. Fortunately, out of that 30 to 40% of complications, only about 15 or 20% are what we would call severe or major complications, and most of those can be managed conservatively without additional surgery. So you'll be eating probably by about the fourth day. Fourth to fifth day, we'll start you on liquids, and then solid food after 24 hours of liquid. So hopefully by day 5 or 6, we'll be eating food. Now, it's generally a slow start. You won't be eating 3 large meals a day or whatever you're accustomed to eating. Generally, what we're looking for is to eat more frequent small meals. So generally, during the first few weeks and even month after surgery, we really encourage our patients to eat meals in small quantities more frequently. We will generally initially ask that you be on a low-fat diet and then gradually increase the types of foods that you're eating, basically trial and error over the next few weeks. I would also ask that you avoid nuts, popcorn, anything that's greasy, fried, any heavy vegetables, which we would call roughage, like Brussels sprouts, cabbage, cauliflower. Those heavy vegetables tend to bind patients up after these types of procedures and can also cause a lot of gas and bloating. So that would be, I think, the most important thing. And you'll speak with a dietitian who will work with you both before surgery and after surgery and before you go home, and they'll give you some ideas and suggestions for the types of food. But what I would like to add to what the dietitian is going to tell you is really the idea of eating small meals more frequently. That's especially true, as we talked about, with the delayed gastric emptying, where the stomach is slow to empty in the initial period after surgery. It becomes very important to eat small, more frequent meals. Patients are always interested in questions about when can you return to work, what limitations might you have, driving, use of pain pills. What I would say is that generally we'll see patients back about 2 weeks after surgery, anywhere from 1 to 2 weeks depending on how the surgery went. Generally we'll ask that you not drive during those first few weeks after surgery until we see you back for your first post-op check. The drains will generally have been removed when you go home. Occasionally you may go home with the drain, and we will do teaching on the management of the drain at the time of your discharge. You will go home on some pain pills, and we ask that you take those as needed. Generally you'll need it for a few weeks after surgery, but we ask you that you please don't drive while you're still taking the pain pills. We don't want you doing any straining or heavy lifting, anything more than about 20 to 25 pounds. Anything that causes discomfort in the abdomen, in all likelihood, you'll be getting an up and down incision, and anything that causes straining or discomfort on that incision you shouldn't be doing. So really anything bending over, lifting, pushing something heavy, we would encourage you not to do that for the first few weeks, and ask family members to help you with that. But you can take a shower, you can do light activity. We encourage that. Stairs are perfectly fine. We would like you to get out of the house and try to walk and exercise. Maybe if you go to the mall, you can walk in the mall. Just have your significant other or family or friend drive you for those first few weeks. Once we see you back in the clinic, we'll go over whether or not it's okay to drive, whether or not you need to be taking any pain medicine. In certain cases, you can add to the pain medicine by taking Tylenol or Motrin. Please discuss that with us, obviously, first before you do that. But as time goes on, over the first few weeks, you'll find less and less of a need for pain medicine, and you can start liberalizing the diet and adding more foods. Again, trial and error. Some things you may find will agree with you, others that won't. We ask that you just introduce one new thing at a time so that we can have a better feeling for whether you're tolerating that or not. At the time of discharge, your nurse will go over with you things that would require you to call us to let us know if there's a problem. Again, the Whipple procedure is a fairly large operation, and you can get infections even after you go home. So most of the major problems we see after the surgery will occur during your hospital stay, but sometimes the healing will continue on for a number of weeks, and you may find that there's a problem even after surgery when you go home. So we're concerned about any drainage from the incision or the drain site, any kind of drainage, whether it's thick or clear. We would like to know about it so that we can see if there's a problem. So please call us for that. Any temperature, any over 38, or if you feel hot or have a chill or sweaty, we would like you to call us about that as well. Also, if you're having problems eating, if you're nauseated, if you vomit, if you feel bloated, or even if you're just not able to eat, you don't feel like you're able to drink as much or eat as much, if you feel dehydrated, those would all be things that we definitely want to know about. If you can, before you call us, check your pulse rate and see what that is. You can do it over 30 seconds or a minute. If you have the ability to do other vital signs like a blood pressure, that'd be great. But if you can just check your pulse, your temperature, and be ready to tell us how you're doing in terms of how you feel, then we have a 24/7 coverage. At night, there'll be one of our surgeons on call. During the day, you can call the GI center and talk to one of our nurses, and obviously we're available at any point if you're having a problem.